Good morning, friends. Today we will be dealing with post traumatic stress disorder, or commonly referred to as PTSD. Moving on to the definition, post traumatic stress disorder is defined as certain severe psychological consequences of exposure to or confrontation with stressful events that the person experiences as highly traumatic. So, when an individual is exposed to a stressful situation and the individual experiences certain psychological symptoms which appear to be severe, then the individual is diagnosed to have PTSD. Looking into the incidence of PTSD, statistical studies have shown that 10.4% of women and 5% of men are prone to develop PTSD. The vulnerable groups in the population which can be affected with this condition include children, disabled, elderly, and orphans. Moving on to the types of PTSD, there are mainly three types of PTSD. The first one is acute PTSD. This is also considered to be anxiety disorder, and acute PTSD can occur with a single event occurrence. For example, car accident, dog attacks, or injuries like burn. Moving on to chronic PTSD, this type usually results after repeated trauma that can be prolonged through months or years, and this is not as a result of a single event. For example, repeated event of domestic violence can lead to the occurrence of chronic PTSD. Delayed PTSD, the third type, is the type of PTSD which usually occurs after 6 months of a traumatic event. Moving on to signs and symptoms. Patients affected with post-traumatic stress disorder may exhibit the following signs and symptoms like restlessness, insomnia, aggressiveness, depression, nightmares, memory loss, intrusion. Intrusion is wherein they will be having recurrent recollection of that traumatic event which they had undergone. Hyperarousal. Hyperarousal is a state wherein the person falls into high alert all of a sudden when he thinks about that traumatic event. That is hyperarousal. Also, the patient can experience avoidance, dissociation, anorexia, that is a lack of appetite, irritability, excessive startle response, anxiety, isolating themselves, and hypervigilance. Hypervigilance is a state wherein the patient will be extremely alert, like they will be in a state of high alertness. That helps them to sense any kind of danger around them, even if there is no danger around them. Once they think about this traumatic event, they feel that they are in a danger, so they will be in a state of super alertness, that is hypervigilance. So these are the clinical manifestations of PTSD. Now let's look into the management. The management part can be classified into general management, pharmacological management, and nursing management. Now, what are the general management? First one is eye movement desensitization and reprocessing, which is otherwise known as EMDR. EMDR is kind of an interactive psychotherapy technique which is used to relieve psychological stress. And we all know that in PTSD, they experience a lot of psychological stress. So, in this therapy, what the therapist does is he directs the patient's eye movements to a certain direction in order to relieve the patient from his traumatic experience. So, that is basically the ideology behind EMDR therapy. Next is relationship based treatment. We all know that PTSD patients have a number of symptoms that interfere with their trust, emotional closeness, communication, their social relationship, and all. So, it is very important as a medical professional for us to focus on a treatment that is based on the relationship. So, one of the most adapted therapy is cognitive behavioral therapy, which is known as CBT. So, CBT is a type of therapy that helps the client to manage the problems by changing the way of thinking and acting. That is how CBT works. Next is emotionally focused couple therapy with trauma survivors. And above all, as a therapist, we have to ensure, as a nurse, we have to ensure we provide a safe environment that will reduce the stress of the patient and helps them to move to reality. Now let's look into the pharmacological management. So based on the clinical manifestations, we will be giving certain drugs like antidepressants if the patient is experiencing depression, like Prozac, Zyrosa, etc. And atypical antipsychotics, mood stabilizers like lithium carbonate or valproic acid, antihypertensives if the patient experiences high blood pressure, and anxiolytics when the patient has anxiety like benzodiazepams. As nurses, our main focus is on nursing management. So these are the points which we have to keep in mind while taking care of a patient affected with PTSD. First is to provide a calm and quiet, non-stimulating environment, because the patient should feel that he is safe in the environment provided for him at the hospital, or else the patient will feel threatened and that can aggravate his clinical symptoms. Second is, as a nurse, we have to make sure that therapeutic nurse-patient relationship is established. Always reorient the client with the present situation. Assist the client to divert the mind from traumatic memory to useful activities. So make sure that the client is engaging in useful activities. Then train up the client in deep breathing, relaxation exercises, which helps to reduce the stress. Also, never give false hope and false reassurances to the client that tomorrow he will get ready, or day after tomorrow he'll be better, all the disease will be gone from him. Don't give such false reassurances. Inquire whether the client is having any suicidal tendencies and monitor his behavior, because the patient can experience depression, and because of his anxiety and depression building up in him, he may land up in suicide attempts. And always support the client in rehabilitation activities. Here I have given some of the important diagnosis, a nursing diagnosis for clients with PTSD. First one is post-trauma syndrome related to distressing event outside of the range of usual human experience, as evidenced by flashbacks or intrusive recollections or dissociation or nightmares. Complicated grieving related to loss of self as perceived prior to trauma or other actual or perceived losses incurred during or following traumatic event, as evidenced by irritability, explosiveness, etc. Social isolation related to repressed fears, panic level of anxiety as evidenced by withdrawal, no eye contact, etc. So this is all about PTSD. Hope you all understood what is PTSD and its various aspects. Thank you.
Wow, that's impressive! You have completed a magic today. For more videos, subscribe. Join our Facebook group and Instagram page for group discussion and live magazine videos for exam preparation in an hour. We start at ClassFly community for students to learn from a friend in a simple way and support them in their own languages. If you are willing to be that one friend who saves us at the exam night preparation, then please join us by visiting classfly.in.